You know that MF usually has a heterogeneous cutaneous presentation. Most patients present with patches that can be hypo or hyperpigmented, as you see here. Some patients will progress to develop plaques, which can also be hyper or hypopigmented. And as you know, when we identify the presence of tumors, we know those are patients that have higher risk of the disease, and those are the patients who often will need some type of systemic treatment. You also remember that many times the disease in MF can have this atrophic look, almost resembling a cigarette paper-like appearance, which is a lot of times called a poikiloderma or an atrophic pattern. And Sézary syndrome patients, those are the patients that typically have generalized redness of the skin, so they're fully erythrodermic. This disease is associated with or without skin exfoliation. We know that there is an immune dysregulation of the skin, so these are patients who are predisposed to have skin infections, and this is actually one of the most common causes of death. They can develop alopecia. They often have hyperkeratosis on the palms and hands, and they have nail dystrophy. And the disease is associated with essentially the circulation of the malignant cells, which often happen in a significant proportion. And these patients also suffer from very pronounced pruritus. And the pruritus is very difficult to control with ways that other patients are typically handled. And in addition to that, these patients also have lymphadenopathy.